بوجودكم معانا في المحاضرة النهاردة اللي هي Staying Safe Through the COVID-19 Pandemic. هو أن أنا كلمتكم امبارح كل الناس المدعوين للمحاضرة دهيت علشان خاطر أقول لكم إن المحاضرة هتبقى مسجلة وخدت موافقة أغلبيتكم. لو في أي حد عايز يعني يكتب لي على المسج وكده إن هو لو مش موافق أو كده يبعت لي. بس إحنا اتفقنا على كده. As we talked to most of you yesterday about that we will record this information session and most of you agreed about this. But if anybody have any concern, please send me on the chat box your concern and we will take care of this. Thank you so much. النهارده بنرحب بوجود جوان حجازي، هي معانا وهي هتلقي المحاضرة اليوم. جوان بتعمل في منظمة الصحة في وينسور وهي ممرضة بالصحة العامة، اختيارات أخصائية للوقاية من الأمراض وخصوصا كوفيد-19، فهي بتقوم بمتابعة الحالات والاتصال بهم. فهي تعمل مع فريق لدعم المجتمع والإجابة على الأسئلة وتوجيه الأشخاص للاختبار ومتابعة الحالات الإيجابية، والناس اللي هم مقربين ليهم بتتابعهم برضو. We welcome Juan Higazi, who is joining us today to present this information session. Juan is a public health nurse and health promotion specialist that has been assigned to support COVID in case and contact management. She works on a team to support the community in answering questions and concerns, to direct people to be tested, as well follow up with positive cases for COVID-19. We all welcome Juan. You can start, Juan.
Thank you, Amira. Good afternoon, everybody. I'm happy to be here today. I just will get started here. So we are going to be talking about the COVID-19 pandemic. The first slide that I'm showing here, I just want to let you know, we do have 3 health unit buildings. One is here in Windsor at the corner of Erie and Olette. One is in Essex, and the other one down here is in Leamington. And go ahead, Amira, sorry.
Okay. هي جوان بتقول لكم ان هي في هيلث يونت هنا في 3 مواقع في وينسور، واحده في وينسور في شارع اوليت بإيري، وانذر هيلث يونت موجوده في اسكس، وانذر وان او واحده كمان في ليمينتون. Yes, Joanne.
Yeah, and so we have various public health programs, really trying to help keep the community healthy and improving health and preventing disease and injury, and making sure that everybody can have access to a healthy community. So I just will let you know, many of you are already familiar with some of our programs, but we do have a healthy babies and children program that provides support to pregnant and young families. We have a healthy schools program, and we do have oral health program. Those are just a few of the different programs that we have at the health unit and that you might already be familiar with.
طبعا هي جوان بتقول لكم على الخدمات اللي بتقدمها الهيلث يونت. فهي بتقول الخدمات اللي موجوده ان هي خدمات علشان الرعايه الصحيه. ففي بروجرام علشان خاطر الناس اللي هم الستات اللي هي اللي بتبقى حوامل، وعلشان اطفالهم عشان ان هم يحافظوا على صحتهم، وفي بروجرامات تانية اللي هم الولاد اللي بيبقوا في مدارس، وبروجرامات عديدة موجودة في الهيلث يونت.
Okay, so just go to the next slide here, and just briefly about today's presentation. So today's presentation was a request by Amira, so thank you, Amira, for arranging the session and for having it recorded so that people can watch it in the future and hopefully benefit from the information. So today is about having your questions answered, and that you know where to go to get credible information. COVID-19 is a new virus and we're all learning. And I'm going to leave time at the end of the presentation for you to ask questions, but I'm going to start with just a very brief introduction and then answer some questions that Amira has already put forward for me to answer today.
هي جوان طبعا عامله الانفورميشن دي علشان تجاوب اسئلتكم، وانا مرتبه الانفورميشن سيشن مع جوان. هتركز الانفورميشن سيشن على معلومات عن اللي هو كوفيد 19 وتجاوب معظم الاسئله اللي انتوا سالتوها وهتسالوها. Go ahead, Joanne.
So, just to let you know that COVID-19 is an acute respiratory infection. It's caused by a group of viruses called the coronavirus. And it began spreading in about December 2019 in China to humans. So the coronaviruses, they're a large family of viruses. Some can infect animals and others can infect humans. And this COVID-19 is infecting humans. And it is a new respiratory virus. It can cause mild to severe illness in people. It's not the same as other coronaviruses that are commonly circulating amongst people and cause, for instance, the common cold. So I'll let you go ahead, Amira.
Yes. هو طبعا كورونا فيروس هو ده فيروس ظهر في شهر ديسمبر في تشاينا، وكورونا فيروس هو فيروس كورونا من سلالة من الفيروسات بتظهر بعد ظهرت أو بتظهر في الإنسان أو في الحيوانات، وهي بتصيب الجهاز التنفسي و بعد ساعات بتبقى الإصابات بتبقى قوية أو بتبقى متوسطة أو بتبقى خفيفة على حسب الفيروس اللي هو الإنسان بيصيب بيه. اتفضلي جوان. Go ahead.
Okay. So one of the first questions that was asked is, what is the difference between airborne transmission and droplet transmission? So viruses like COVID-19 are transferred through large droplets. And those droplets are created when someone sneezes or coughs, and they come in contact with the eye, the nose, or the mouth, allowing entry into the body. That's called droplet transmission. So typically when someone coughs, those droplets that you cough out can spread up to 2 meters, and then they drop to the ground or to a surface. So that's how the COVID-19 is spread. It's spread by these droplets, similar to other viruses like influenza. Influenza is also spread like that, and so was SARS. Airborne transmission, on the other hand, happens when evaporated droplets, so the viruses in the droplets, stay in the air for a long period of time. And the transmission occurs when someone breathes in the virus or gets it into their throat or lungs. Diseases such as tuberculosis, measles, and chickenpox are transmitted by airborne transmission.
هي بتقول ان هو ايه الفرق بين ايربورن اللي هو السؤال اللي هي قالته دلوقتي عن الايربورن والاصابه بالفيروس على طول. الفيروس ده بينتقل باللي هو الرذاذ. لما بنيجي نتكلم نطلع رذاذ، الرذاذ ده لو جه علينا او تنفسناه ممكن يحصل لنا الاصابه. والرذاذ ده ممكن يعني وحد بيكلمك ممكن يوصل لك عن طريق يعني ما بين 2 متر، ممكن يوصل لمسافه 2 متر. في حالة انت لما بتتكلم والرذاذ ده ممكن يجي يدخل مثلا في الجهاز التنفسي ليك او عينيك او اي يعني اللي هي الاماكن الحساسه اللي ممكن تدخل عنها عن طريق الانف البق او التنفس او اي حاجه، او لو هو وقع على الارض، ولو وقع على الارض او الاسطح هو بيتبخر، ولما بيتبخر برضه بيفضل الفيروس موجود وممكن نستنشقه، وهو بيقعد وقت كبير في الجو. وده زي يعني زي الانفلونزا، وهو كمان زي التشيكن بوكس برضو. Joanna, you talk about chicken pox and proboscis.
That's right. So Amira, I'll just go back here because I think maybe I said too much at one time.
Yeah.
So I just want to clarify. So there are two different ways that viruses can be transmitted. So they're asking, what is the difference between droplet transmission and airborne transmission? So influenza and COVID are through droplet transmission. It's getting in contact with those droplets, those qatarat, those droplets that come out of us. If somebody comes in contact with them, but they're not just floating in the air, those drop after to a surface, and they can live on a surface. Somebody will touch that and then touch their face, and that virus can get into them. So there is a difference. The airborne viruses are viruses that are staying in the air. So we don't believe that COVID is transmitted, for instance, through the ventilation. It's not transmitted through the water. It's specifically through those droplets, whether they're on a surface or whether it's directly touching those droplets. Did that make better sense?
Yes, yeah. هي بتعيد تاني، بتقول ان هو الفيروس ده بيتنقل عن طريق القطرات او الرذاذ، وهو القطرات والرذاذ دي بيتنقل بيها الفيروس، وزي الكوفيد 19 والانفلونزا. وهو مثلا لو وقع على الاسطح، والاسطح الملوثه دهيت واحنا لمسناها، دي يعني هيجي لنا نتعادى بالفيروس وكده. كمان هو ما بيتنقلش الفيروس عن طريق الميه او انظمه التهويه.
Excellent, thank you. So the next question is, what will I do if someone that I know is sick with the coronavirus? So if someone does have symptoms and has been tested and they are positive, we at the health unit will follow up with them. We follow up with everybody that is positive. We get that report that it's been tested. We get that report and we will follow up with them. We will then ask who they were in contact with and determine whether or not that person is a close contact. So you may be asked to isolate. If you are positive, we will ask you to isolate for 14 days. If you have been deemed as a close contact, so it is possible that we call you and say, you have been identified as a close contact, you will need to isolate. We cannot share with you who the positive case is, but we can let you know that you are identified as a close contact.
الهيلث يونت طبعا بتتابع اللي هم الناس اللي بيبقوا عندهم كوفيد 19 وهو ايجابي. طبعا بتتابع معاهم، بتكلمهم، وبتشوف برضو الناس المحاوطين ليهم. ان كان في حد محاوط ليهم بيتصلوا بيه وبيتابعوا معاه، بيقولوا له انك انت مثلا كنت مثلا قريب لحد عنده كوفيد 19. طبعا هو ما بيقولوش على مين، لو هو كان مثلا كان مقرب لحد او مع حد مثلا كان عنده الكوفيد 19. زائد كمان بيطلبوا منه ان هو يعني يبقى في عزله لمده 14 يوم، وبيتابعوا معاه على طول وكده، وبيدوا له معلومات وكده. Go ahead, Joanna.
So with isolation, we ask you to stay home. If you have other people in your household, we'll ask that you stay away from them. Use your own towels, for instance, Make sure that all surfaces that you touch are cleaned frequently. And isolation is for 14 days. So whether you're a contact or whether you are a positive case, we will ask that you isolate for 14 days. If you are a contact, you will continue to monitor, and if you develop symptoms, you can then get, we will recommend that you get tested or let your healthcare provider know.
طبعا لو حد مثلا عنده الكوفيد 19 هيحتاج منه ان هو يعتزل يبقى في عزله لمده 14 يوم، وفي العزله دي طبعا مش هيستخدم يعني حاجاته الشخصيه هيستخدمها بس ما حدش هيستخدمها معاه. اي سيرفيس او اي مسطحات هيلمسها زي اي اسطح لازم تكون تتطهر بعد ما انت تستخدمها. واللي هو اي حد كان قريب لاي حد عنده كوفيد 19 هيطلب منه ان هو برضو يعمل عزله، وفي العزله دهيت لو حصل اي ظهور لاي اعراض طبعا هو هيتصل بيهم وهم هيفضلوا متابعين معاه وكده لأي أعراض هتظهر على الشخص اللي هو كان مقرب للي هو كان عنده كوفيد 19.
Excellent. And another reason that people are put in isolation is if they've done any travel outside of Canada. Anybody that is coming into Canada needs to isolate for 14 days.
أي حد هيسافر برا كندا لازم يقعد في عزلة لمدة 14 يوم.
Okay, so the next question was about how can we stop the spread of the virus? And so there are some very key things that we can do to prevent the spread of the virus. And so you can see here, we do recommend, because those droplets can travel a distance of up to 2 meters, we do recommend that you physically distance, meaning you stay, leave a distance of 2 meters away from somebody. Also that you wash your hands frequently using soap and water for at least 20 seconds or use an alcohol-based hand sanitizer. When you are out and you may not be able to ensure that you're going to be 2 meters away from somebody, you should be wearing a mask, and the mask should be covering your nose and mouth. Again, because they're transferred, the droplets can be transferred by you touching something and then touching your face. We recommend that you don't touch your face and that you exercise respiratory etiquette, which means that when you do cough or sneeze, you use a tissue, throw it away, and wash your hands immediately. And if you are not feeling well, you should do the self-assessment and not go out at all to work or to school or anything like that. Okay.
طبعا علشان يساعد بمنع انتشار فيروس كورونا لازم بنحافظ على مسافة المترين عن أي شخص يكون متقارب مننا. ده هيمنع إن هو الرذاذ إن هو يوصل لنا. لازم نبقى نغسل إيدينا بمية وصابون كويس لمدة 20 ثانية. لازم نلبس اللي هو الأقنعة لو أنت مش هتقدر تتباعد عن الشخص مثلا اللي هي المترين. لازم تلبس اللي هو القناع الواقي علشان خاطر تحمي نفسك. طبعا لازم تتجنب انك انت تلمس اللي هو العين او الانف او الفم قبل ما تغسل يديك. لو انت عندك مثلا بتعطس او كحة او غيره لازم تغطي مناخيرك وفمك بمنديل. لو ما كانش معاك منديل يا ريت تغطيه بكوعك. لو انت حاسس انك انت تعبان او درجة حرارتك مثلا عالية او في اي مثلا مثلا كحة أو غيره، يا ريت تفضل في المنزل. Go ahead, Joanna.
Okay. So the next question was about how often should I wash a cloth mask or a non-medical mask? What are the difference between the use of medical masks versus cloth masks? And so I want to just review first how to safely wear a mask. So it's very important that before you put your mask on that you do wash your hands. Make sure that it fits your mouth and your nose, and you don't touch your face while you're using it. So that's one of the things that you want to make sure of here, is that you want to try and not touch your face, and oftentimes the mask might help you not touch your face so that you're not transferring the virus from possibly your hands to your nose and mouth. You want to make sure that the mask fits nice and tightly around, and that it is comfortable for you.
هي دلوقتي جوانا كان عندها سؤال، بتقول السؤال اللي موجود عندها، بتقول ايه الفرق ما بين اللي هو غطاء الوجه او الوش اللي هو الطبي والقماش. فهي قالت قبل ما يعني هنتكلم الاول ازاي هنلبس القناع. قبل ما نلبس القناع لازم نغسل ايدينا، وبعد ما نخلعه برضو نتأكد ان هو انك انت لابسه وماسك او مغطي الفم والانف. بتقول لما تيجي تلبسه يا ريت ما تلمس وجهك او تلمس القناع نفسه لما تيجي تستخدمه.
The cloth mask is a good way of protecting other people from your droplets. So the droplets will stay within your mask and they won't be going out the 2 meters rather. Whereas a medical mask are created to provide protection from splashes and sprays as well. And the outer side is actually fluid resistant, and it's made from, there's a filtration system, and then there's an inside absorbent. We don't recommend that you wear a medical mask. We do recommend that you do wear a cloth mask, and that is what we want. We want to protect your droplets from not being transmitted.
هي بتقول ان هو الكلوز ماسك اللي هو القماش، اللي هو الماسك بتاع القماش ده بيمنع ان هو يطلع الرذاذ اللي هو او القطرات اللي هي وكده، اللي هي يعني بتروح لحد 2 متر وكده. هي بتقول على الميديكال اللي هو بتاع اللي هو الطبي، بيبقى فيه زي فنتليشن، يعني بيمنع ان هو مثلا Joanna, you mean about ventilation for the medical mask? The ventilation, it is. Would you want to say it again?
Yes. So the medical mask is made differently, and there is a third layer that is for filtration. So. Yeah. It's possible for a cloth mask. We only recommend that it is 2 layers. It doesn't need to be more than 2 layers, and there doesn't need to be a filtration system or anything like that. So just as long as it is comfortable for you to wear, because the idea behind the cloth mask that we wear is to protect our droplets, so make it so that our droplets are not going out. So it's got a different purpose than the medical masks, and we don't recommend that you need to go out and get a medical mask. We do recommend the cloth masks be worn.
اوكي، هي بتنصحكم انكم تستخدموا اللي هو القماش، الماسك القماش، لان هو بيبقى عليه ويبقى عليه تو لير، لان ده هو بس بيمنع الرذاذ. لكن الميديكال ماسك اللي هو الطبي بيبقى فيه هما بيبقى عباره عن ثلاث طبقات، فيهم منهم طبقه بتبقى الفيرتيليشن، يعني بتمنع بعض حاجه بتعمل حاجه اكتر يعني. بس هو المهم الميديكال سوري اللي هو القماش، الفيس ماسك القماش اللي هو يعني بتنصحكم انكم تستخدموه.
Yeah, and the medical masks, they're really needed for the healthcare workers, and that's why we don't want there to be a shortage for medical masks. So basically, that's the idea. To wear the cloth masks is fine, and it can be made from materials that you have around the house that are comfortable for you, and that will protect your droplets from going out. Okay.
اوكي، يعني هي بتقول يعني في الاخر اللي هو القماش ده اللي انتوا يعني بتنصح انكم تستخدموه. التاني اللي هو الطبي ده الدكاتره بتستخدمه، وهما بيقولوا يعني علشان خاطر كمان ما يحصلش ان هو تقل اللي هو الاقنعه الطبيه للدكاتره وكده.
So when putting on your mask, it's important that you always wash your hands before and after putting on, and when you're before taking off your mask. So when wash your hands, so you wash your hands either using a hand sanitizer or with soap and water. Handle the mask from the ear loops and put it on and take it off that way using the ear loops. Make sure it covers your mouth and nose and it doesn't feel safe. It's important that you should wash your mask after taking it off. So what I do, for instance, when I go grocery shopping, I put my mask on. I use my hand sanitizer, put my mask on in the car before I go into the grocery store. When I come out after I put my groceries in my car and I get in my car, I have a little bag there. I take my mask off, just touching it by the ear loops, and put it into that bag. I don't want to touch the front of the mask. And then when I come home, I take that baggie and just throw it in the wash machine to wash it. It can just be laundered with regular laundry detergent. Okay, you don't want to ever wear a dirty mask. You don't want to share a mask. And you don't want to wear your mask around your chin, not covering your nose. Because remember, we're trying to prevent our droplets from going out.
هي بتقول طبعا قبل ما نيجي نلبس الماسك بنغسل ايدينا او بنعقمها بالكحول وكده او الهاند سانيتايز. لما بتيجي تمسك الماسك بتمسكه من الرابطه او من الاستك وبتحطه وتلبسه. لما بتيجي تلبسه لازم تتاكد ان هو مغطي الانف والفم وما يبقاش واسع. هي بتقول لما بتيجي تروح الماركت او تروح تتسوق قبل ما بتنزل من السياره بتقوم بتعقم يديها الاول وبعد كده بتلبس الماسك. بعد كده بعد ما بتدخل وتتسوق وكده ما بتيجي تركب السياره بيبقى معاها كيسه بتقلع الماسك وبتحطه فيها. بتقول ان هو لازم يعني تغسل الماسك بتاعك ويبقى نظيف. زائد ان هو لما بتيجي تلبسه ما تخليش الماسك يبقى نازل من تحت مناخيرك يبقى مثلا على دقنك، لان احنا بنحاول ان احنا نخلي نحافظ ان هو ما يطلعش اي قطرات من فمنا او نتنفس اي قطرات من اي جهه.
So we often talk about physical distancing. Again, physical distancing is leaving that 2-meter distance. And then, you know, doing essential trips. Oh, I'm sorry. I'm going to go back here to that last slide. doing essential, staying away from crowds. You don't want to have social gatherings or be in large crowds, and you know, connecting with people. We still want people to be socially connected, but in different ways, and that's what we're doing today over this webinar, connecting virtually as much as possible. But it is important to stay connected, especially you know, for our own mental health well-being.
طبعا هي يعني اتكلمت عن التباعد الجسدي، فهو المفروض ان احنا لما نيجي نخرج بره المنزل لازم يبقى فيه تباعد عن الاخرين، والتباعد ده لمسافه 2 متر. طبعا لو انتم مش يعني بتقول يعني لازم يعني او كويس ان احنا نتجنب الخروج الغير ضروري من المنزل، نتجنب اللي هو التجمعات الكبيره. طبعا هي مهمة قوي، هي بتقول مهم ان احنا نفضل نفسيا وعقليا صحيين، فالتواصل الاجتماعي مهم، فاحنا ممكن نعمل تواصل اجتماعي بالتواصل الالكتروني زي ما احنا بنعمل حاليا دلوقتي، احنا متواصلين الكترونيا وكده. Go ahead, Joanna.
Okay, so I just want to remind everybody of the respiratory etiquette, and this is also a good reminder for our children in that when we do cough or sneeze, that we cough or sneeze into a tissue and throw the tissue away immediately. If the tissue, and then wash our hands, of course. If the tissue is not available, using our elbow, and then again, washing our hands, sanitizing afterwards.
طبعا لو احنا بنكح او بنعطس مهم قوي ان احنا نغطي الانف والفم بمنديل، وعلى طول نرمي المنديل وبعديها نغسل ايدينا على طول. لو مش في امكانك او معاك منديل، حاول لو عطست او كحيت تكح على الكوع ايدك، وبعد كده تغسل ايديك بالميه الدافيه والصابون، او تعقمها بعد السعال والعطس.
Okay, so one of the questions was, how do I make my own disinfecting product and hand sanitizer? And the short answer for that is you don't. It's better to buy your household disinfectants or your hand sanitizer. So I don't have a recipe for that, but I will remind you that, as we talked about before, it is very important that we clean high-touch surfaces. So high-touch surfaces are surfaces that we touch often, but we often don't remember to clean them, such as a doorknob. You may not think of cleaning your doorknob, but just making that part of your daily routine is that you do want to think about those droplets could be on the doorknob, and we know now that droplets live on surfaces for an extended amount of time.
كان عندها سؤال بيقول ازاي نعمل المطهر بنفسنا في البيت، فقالت هي من يعني بتقول يعني احسن انكم انتوا تشتروه. مهم قوي ان احنا نطهر الاسطح والحاجات الاسطح اللي هي بيبقى عليها الضغط في الاستخدام، زي مثلا أكر الباب، وخصوصا ان الفيروس بيعيش على الاسطح لفترات كبيره، منها زي مثلا أكر الباب. Go ahead, Joanna.
And I just want to remind everybody that on any product that you buy, any disinfecting product that you buy, that it is really important to read how to use it. Oftentimes, it'll say that it needs to be diluted in water. You need to follow those instructions. It's not better to make it a higher strength, but it's better to follow those instructions that are on the bottle of anything that you buy.
بتقول لما تيجي تشتري اللي هو البرودكت اللي هو بتاع التطهير او اللي هو ديسانفكت وكده، لازم انك انت تقرا عليها علشان تشوف ازاي تستخدمها، لان في بعض منهم بيطلب منك انك انت ديليوتد، يعني انت بتحطها بنسب معينه مع مثلا مع ميه او كده تخففها او غيره. فمن الاحسن انك انت تقرا ازاي بتستخدمها علشان تقدر تستخدمها صح وكده.
Okay, so the next question that I received is, can I catch COVID-19 by touching mail or paper packages? And another question related to surfaces was, what is the proper technique for disinfecting surfaces and other? And so I just want to let you know that on our website, and I'm going to show you an interesting thing about our website in a moment, but on our website, there is a list of how long the virus can live on different surfaces. So these are the different surfaces, and this is how long they can live. And you can see that some viruses, although can live, just for moments, others will live for days. So very important that you do realize that it is important to clean surfaces. So the question about touching mail or a paper package, so any package that comes to the house, especially if it's come through the mail, has most likely been in transit for a while. So the chances of you getting the virus from touching the packages may not be that high. However, it's good practice to always wash your hands after touching a package. And it doesn't harm to just wipe it down. So if you just wipe down the package or anything that you bring into your house, just give it a good wipe down. That is actually a nice habit to be in. And then again, after touching the package, just be sure that you do wash your hands. And we talked about cleaning surfaces. It is important to use just whatever you normally use for household cleaning, and to just be mindful of just giving all of your countertops, high touch surfaces such as doorknobs, a good wipe down, at least once a day.
هو كان عندها سؤال بيقول لو في حد بيسأل بيقول لو أنا ممكن يجيلي كوفيد 19 من إن أنا مثلا أمسك بريد أو مثلا اللي هو الكراتين اللي بتيجي مثلا في الميل. فهي بتقول يعني هو الحاجات دي ممكن تقعد في ترانزيت فترة، فهو يعني احتمال، يعني مش احتمال يعني، بس بتقول لازم نعمل مثلا تدريب كويس ان احنا اي حاجه تدخل عندنا نطهرها نمسحها كده ونطهرها. هي حاطه على الويب سايت زي ما انتم شايفين اللي هو الكوفيد 19 او مثلا الفيروس بيقعد قد ايه على الاسطح. ففي بعض فيروس بيقعد ساعات، وبعض فيروس بيقعد على اسطح ساعات، وبعض اسطح بيقعد عليها ايام. فبتقول از جود براكتس ان احنا، او تدريب كويس ان احنا نطهر كل حاجه. مثلا الحاجات الاسطح اللي هي بيبقى عليها ضغط مثلا زي أقر البيبان وكده، يعني يستحب ان احنا نطهرها يوميا كده. اتفضلي جوان.
Excellent, thank you. So the next question was, how do I wash the fruit and the vegetables to prevent the transmission of virus, and what kind of food or vitamins will strengthen the immune system to prevent COVID-19? So I just have here a picture of the Canada's food guide, and it is available in Arabic, just to let you know. But really, insofar as what kind of food or vitamins are going to strengthen our immune system, there really is no supplement or any kind of vitamin or natural health product that's going to prevent you from catching COVID-19. It is very important to just make sure you keep up with your hand washing and, continue to eat a diet rich in fruit and vegetables, whole grains, proteins, and that'll help to build a strong immune system.
هي في سؤالين جايين لها، بيقول واحد بيقول إن هو إزاي تغسل اللي هو الفاكهة والخضار واللحمة والفراخ عشان يعني ما يبقاش فيه أي عدوى. السؤال التاني بيسأل عن الأكل الصحي والفيتامينات اللي احنا نقدر ناكلها في الفترة دهيت عشان خاطر يمنع اللي هو الإصابة. هو قالت ما فيش مثلا فيتامين معين أو أكل أو حاجة محددة، بس هي بتقول ناكل أكل صحي كويس، مثلا الهول جرين اللي هو الحبوب الكاملة مثلا في العيش بتاعنا والرز وكده، أو القمح، الفاكهة الخضار الحاجات دي كلها، ويبقى أكلنا كامل وكده، وده يعني هيقوي مناعتنا.
And as far as washing your fruits and vegetables, it's important that you wash them. Washing them with running water is good enough. You don't need to add any kind of soap or anything like that. That's not recommended. Just running water, washing your fruits and vegetables is important, and that's all that needs to be done.
هي بتقول في الغسيل اللي هو الفاكهة والخضار نغسلهم ب مية جارية، مش محتاجين نحط عليهم أي إضافات زي صابون أو غيره، هو كفاية إن احنا نغسلهم في مية جارية.
Okay, so lastly, to boost our immune system, like fighting anything, it's important to lead a healthy lifestyle. So just the certain habits like making sure you get enough exercise, not smoking, getting enough sleep, and managing stress are excellent ways, as well as eating, to boost your immune system.
علشان ننمي الجهاز المناعي بتاعنا أو نخليه قوي، لازم تكون يعني حياتنا العامة مثلا إن احنا نبقى رياضيين، إن احنا ننام كويس، إن احنا ناكل كويس، كل الحاجات ده هي بتنمي الجهاز المناعي لينا.
Okay, so the next question is, how can I support my children returning to school? Really important to support and engage your children by listening to what their concerns are. The best thing that we can do is to model the behaviors that we talked about earlier. Modeling these behaviors and being positive about them, about the precautions, will be a great way of teaching our children what they should, what they can do to help prevent the virus. Let them know that you're not touching your face, because this is how the virus can enter. Show them that you know, you're using a tissue only once and throwing it away and then washing your hands afterwards. So these are all things that you can do to remind them, you know, of these habits without telling them don't do this and don't do that.
بتقول عشان نعلم ولادنا، علشان طبعا هم هيروحوا مدارس وكده، او نعلمهم عامة ان احنا نكون مثل اعلى ليهم. هم لما يشوفونا هيتعلموا مننا، هنعرفهم ان هم ازاي يبقوا عندهم يعني احتياط، او يعني يعملوا الحاجه الصح، بدل ما احنا نقول لهم لا ما تعملوش. هم هنقول لهم يعني الحاجه هي المفروض تتعمل، ان هم مثلا زي ما احنا اتكلمنا ان احنا نحافظ على التباعد، غسل اليد مثلا، لو استخدموا منديل ومسحوا بيه مناخيرهم او العطس او الكحه، يستخدموه مره ويرموه في الزباله، وبعد كده يغسلوا ايديهم، ان هم ما يلمسوش وشهم، عينيهم، انفهم او فمهم، لان ده عن طريق اللمس الوجه بينتقل الاصابات او العدوى او كده.
So just to let you know that there is the self-assessment that can be done online, and that here in the area we do have 2 assessment centers, one that is located at Windsor Regional Hospital Outlet Center, and one is in Leamington at the Erie Shores Center there.
بتقول إن في هنا حاجة اللي هي التقييم الذاتي لفيروس كورونا، وهو موجود على موجود فيه منها في ريجيونال هوسبيتال اللي هي هنا في وينسور، وعندنا واحدة تانية في ليمنتون.
Okay, again, a reminder that you should not be going. And now these next few slides will be very quick. They're just quick reminders and reviews.
بتقول ده هنا لو انت تعبان يعني ما تخرجش ولا تدخل اي مبنى لو انت تعبان.
Okay. And we talked about staying 2 meters away from anybody, and when you're out and about, and using the to keep that physical distance, to stand back, to sanitize, hand sanitize. Oh, here we are. To stand back and to wash our hands. And this one here I'll stop at, because here we want to make sure that we are teaching our children the importance of washing for 20 seconds. A good way to do that is by creating a song or by counting to make sure that they are scrubbing long enough.
هي طبعا هي رجعت بسرعة الحاجات اللي احنا قلناها اللي هي علشان خاطر التباعد الاجتماعي او التباعد الشخصي ما بينك وما بين الاخر 2 متر، غسل اليد. طبعا هي بتقول نشجع الولاد ان هم يغسلوا ايديهم وتكون لمدة 20 ثانية، وعلشان تعرف ان هو غسل ايده لمدة 20 ثانية ممكن تغني اغنية ليهم او مثلا تعد ارقام كده.
Okay, and for sure, if they're not feeling well, it's best not to have them go on the bus. They should not be going on the bus, and discouraging our children from sharing any items now that we know that the virus does live on surfaces.
هي بتقول لو في أي طفل مثلا أو أي حد تعبان ما يركبش الأتوبيس أو أي مواصلات ويعلمهم. كمان ما يشاركش حاجاته الشخصية مع أي شخص، لأن طبعا الحاجات الشخصية ده طبعا لينا وليهم الأطفال، لأن الفيروس بيعيش على الأسطح.
Okay, and so what I want to tell you is that we are here to help you. And I did show you the picture of the health unit, but we don't recommend that you come into the health unit now during COVID times. We do recommend that you go to our website. And I'll just go back again here. If you go to our website, which is wechu.org, this is what will come up. You will see at the top there is a picture of an ear. If you click on that picture of the ear, it'll bring you to a selection, and you can select the Arabic language. Everything will be translated into Arabic, and so you'll be able to read it in Arabic, or again, you can click and it will read it for you in Arabic.
اوكي. هي بتقول على الويب سايت بتاع الهيلث يونت ممكن تدخل وتاخد معلومات عن اللي هو الكوفيد 19. لو انت عملت كليك في علامة أذن على اليمين في الشاشة ده، هي لو انت عملت عليها كليك ممكن تطلع اللغة اللي هي العربية، وتقدر تقرأ بالعربي عن الكوفيد 19 ومعلومات عنها وكده. وبرضو في خاصية ممكن تسمع وهي يعني بدل ما تقرأها ممكن تتقرأ لك باللغة العربية.
Okay, so that's the end of the presentation. I just wanted to make sure that you knew that. And it's not just about COVID that you can get information. It is about all many of the different departments will have their information on the Health Unit website, as well as we do have information from our partners. So it is a good website to go to. All of the information is evidence-based, so it's a good source of information rather than asking, a friend. You would be better off to go to the website or just searching Google. It's better off to go for health information to come to the website and get your information. Okay.
هي بتقول لكم ان هو الويب سايت بتاع الهيلث يونت هو بس مش لكوفيد بس في معلومات غنية لخدمات تانية او مثلا اقسام تانية. فبدل ما انت تروح على جوجل عشان تاخد معلومات، انت ممكن تدخل على الهيلث يونت وتقدر تاخد المعلومات اللي انت عايزها في اي حاجة انت محتاج تعرفها بخصوص الصحة.
All right, and now, Amira, I just want to ask you, do you have any questions in your chat box?
في أي حد بعت لي أي أسئلة؟ عندكم أي أسئلة؟ Okay, I have.
Okay.
There is one question say if my clothes, when I am wearing my clothes outside, when I go home, I have to wash it right away?
Okay, so that's a very good question. Thank you for asking that question. We know that the droplets do live on surfaces, including clothing. So you want to be mindful of that, depending on where you have gone. Has anybody coughed or sneezed on you? So if you are working, for instance, I'm working as a nurse, so yes, obviously before I leave work, I take my clothing and I change it, and then I wash those clothes immediately because I may have come in contact even though I was, covered up. But if you have gone out shopping, depending on what you've done, just again, thinking about that virus can live on clothing. So you don't want to be touching somebody's clothing and then touching your face. So don't touch your face and wash your hands frequently, and wash your clothing just as you normally would if you're not in a high risk situation.
هي بتقول هو ده سؤال كويس. بيبقى على حسب انت كنتي فين مكانك. مثلا هي بالنسبة ليها كشغل نيرس، فطبعا لازم هي اما تروح تغسل هدومها وكده. لو حد مثلا عطس عليك او على حسب انت زيارتك للمكان نفسه وكده، او طبعا لو انت حد عطس عليك او مثلا لمست هدوم مش واثق ان هي متوسخه باي حاجه من مثلا عطسه او كحه او كده، يا ريت ما تلمس وشك بعديها علشان ما يتنقلش اي عدوى. Joanne, there is another question. They said that one of the client, her son, he was outside of Canada, and when he came, he went for a test, COVID-19 test, and he was negative, but they asked him to stay 14 days, isolated.
Yes. Right. So anybody that has been outside Canada, they will be asked to isolate for 14 days. Now, even if his test came back negative, because we need to wait for that 14 days to make sure that he doesn't develop symptoms. So it may take a while for someone to develop symptoms or to show a positive result. And as a measure of protecting the community, anybody that has been identified as a close contact or somebody that has traveled or somebody that is positive must isolate for 14 days. Again, I want to remind people that once you get tested, you should also be in isolation until you get your results. So if you're just going for a test, that's fine. You wait for your results. But if you isolate only until your results. But if you've been out of the country or you've been identified as a contact, you must finish the 14 days of isolation. Is that clear?
هي بتقول حتى لو هو عمل التست وطلع سلبي وكده، هو لازم يعمل عزل لمدة 14 يوم، لأن ما بتظهرش الأعراض يعني ممكن تظهر الأعراض في أو يعني مثلا بتقعد فترة عقبال ما بتظهر وكده، اللي هي فهي الفترة اللي هي المحددة 14 يوم عشان يشوفوا هيظهر في خلالها أي أعراض، أو مثلا تزيد أي حاجة مثلا. حتى لو هو ما عندوش أي حاجة فهو anyway لازم يعني قصدي عنده الاختبار بتاعه كان سلبي، برضه لازم يقعد ال 14 يوم عشان يحافظ على نفسه وعلى الناس اللي حوالين منه. Another question, there is one she's asking about medical mask can be washed with soap.
So your mask should be washed with whatever laundry detergent or detergent that you use, and warm water, or or the hottest cycle that you can use for that for that fabric. Now, if she's talking about the disposable masks, those are one-time use only. Once you use those need to be disposed of in the trash, not on the ground. They need to go in the trash, because again, we don't want to be spreading that virus. Can be living on the outside of that mask, and we don't want to be spreading that virus. So we want to make sure that if we are wearing disposable masks, which I see a lot of people are wearing, and they're even available in some some places are offering them to the people that go there. If they are disposable masks, they do need to be disposed of properly. They're not meant to be reworn once they are soiled or used.
بتقول اللي هو الأقنعة الطبية هي معمولة مخصوص بس عشان تستخدم مرة واحدة، وما ينفعش إن هي تتغسل. أو بعد ما أنت تستخدمها يا ريت ترميها على طول في الزبالة، طبعا عشان في بعض من الناس بيرموها أو على الأرض أو كده، فده بيبقى مثلا عرضة إن هو ينشر الأمراض. فهي مرة واحدة للاستخدام. Another question, just 1 minute. How do we know? There is one client, she's saying, how do we know that we are infected with a virus? And are there infected people who didn't show symptoms of the virus, and who is exposed most of the adults or the children?
Excellent question. Yes, there are people that are asymptomatic, we call them. They don't have any symptoms, but they can pass the virus. So this is why we must do an investigation every time we receive a positive result. And we will call and find out where did they go, and we will contact you if you have been identified as a close contact and ask you to isolate. So yes, the answer is yes. There are people that do not have symptoms, but they are positive and they can pass the virus along. And that is why we're asking everybody to wear a mask to protect us from their droplets. And we're reminding people to wash your hands frequently. Do not touch your face and cough and sneeze into a tissue and throw it away or into your elbow.
هي بتقول في بعض من الناس اللي هم بيبقى عندهم الفيروس مش بيبقى ظاهر عنهم، ولما مثلا بيعرفوا انك انت كنتي قريبه لحد وطلع عنده الفيروس، هم بيتواصلوا معاكي وبينصحوكي. عشان كده هم بينصحوا ان احنا نلبس الماسك دايما علشان خاطر نمنع ان هو ننشر الفيروس ده بالقطرات اللي بتطلع مننا وكده. There is another question she's asking, who is exposed to most of the adult or children?
Who's
most, yeah, exposed most, adult or children?
Who's exposed more, adults or children? Honestly, I don't know the answer to that. The virus is, anybody can be exposed. It has a greater effect. It has a more severe effect, it seems, on older adults and adults in general than it does on children. But again, remember, this is a new virus. We don't know all of everything about it. We don't know if there's going to be long-term effects. So that is why the best thing to do is, as a community, we have to try and prevent the spread of it.
هي بتقول احنا ممكن اي حد يتعرض بالإصابة، بس الناس اللي هي بتتعرض اكتر اللي هم الادلت والكبار في العمر. هو طبعا الفيروس ده جديد بالنسبة لنا، ومش عارفين هيقعد مأثر علينا لمدة قد ايه، فلسه لسه يعني حاجة جديدة عليهم وكده. Just 1 minute. She's asking about the face mask, closed face mask. It will be washed every time we wear it, or we can wash it like every week?
That's a good habit. So you shouldn't be wearing a face mask that is dirty, soiled in any way. And I don't know about you, but I find that my face mask, because I'm breathing in it and talking, and it gets wet on the inside. So once it's wet, I consider it soiled. So I have a couple of them, and you wash one, you wear the other one. And so it is a good habit to wash it after you use it. Like I said, just have a little baggie, put it in the baggie, and make it part of your habit that when you come home, throw it in the in the wash machine, or wash it by hand and hang it to dry. But yes, you should not wear a soiled mask, and never share a mask. They are for one person. A mask is for one person only.
هي بتقول يعني لازم يتغسل كل مرة احنا بنستخدمه، لأن لما بتستخدميه طبعا بيتبل من جوه، فيعتبر كده هو مش نضيف، فلازم يتغسل. فمثلا يبقى عندك 2 تبدلي فيهم أو أكتر، مجرد انك انت تستخدميه تحطيه في باج لحد ما انت، أو شنطة لحد ما انت تغسليه وكده. بتقول طبعا ما نعملش شير او ان احنا نشارك تديه لحد يستخدمه بدالك، في لو انت بتستخدموا فيس ماسك مع بعضيكم، فده طبعا ممنوع تماما وكده. Another question, there is another question they say about I don't know how to say it in English, like you know
try it in Arabic.
Okay. كيف نعمل فحص الأجسام المضادة لنعرف إذا أصبنا بفيروس كورونا من قبل، وهل يتم الفحص مجانا؟
Yes, the test, if you choose to go and be tested for the coronavirus, it is for free. Like I said, at those 2 locations, either in Windsor or in Leamington. The results come back fairly quickly. You don't have to, we will not call you for a negative. You can go online and check for the results yourself. For a positive, if there's a positive result, we will call you. So, and it is it's like a long Q-tip that is inserted into the nose. So it's not a blood test. It is it's very quick, and it is something that you can choose to do. You can go and get tested, and if you feel you may have been around a group of people or not sure, and or you're having any symptoms at all, you can talk to your healthcare provider, or you can just go and get tested.
Yeah.
Did I answer the question, Amira?
I think she means something else. She said that الأجسام المضادة, like immune, like
Right.
when we get vaccinated and we have a little virus or like our
okay, the antibodies. I think
antibodies.
Yes, there is no. We're not testing for antibodies right now here for the general public. I know that they're doing some research with that, and there may be certain groups that are tested, but not the general public. We're just not. You can't just go in and ask for an antibody test at this point. Right now, the only thing that they're doing is testing for the virus. And remember, when you get tested, you're just testing in that moment. So you might get tested today, but then come across the virus tomorrow, and that could change. So the best thing is to continue to monitor ourselves every day. Ask yourself, how do I feel today in the morning? Am I having any symptoms? And if you feel that you're having any symptoms, and the symptoms are varied from, some people might have a fever, but some people might never have a fever. Some people might have a cough, some people might not. Oftentimes there's things like sore throats or a sore throat, or not able to smell or to taste. Those are symptoms. Having diarrhea, vomiting, those are symptoms. A headache, that can be a symptom. So if you're having anything unusual and you're not feeling well, it is a good idea to just speak with your healthcare provider and to be tested. Even though right now a lot of healthcare providers are asking that you call, it is important that you call and do that discussion with them, or come to our website and do the self-assessment yourself.
بالنسبة للي هو الأجسام المضادة، فحص الأجسام المضادة هي دي مش موجودة، لكن حاليا لكن اللي موجود دلوقتي إنك أنت لو أنت عايز تروح عشان تشوف اختبار اللي هو الفيروس إن كان عندك أو كده، وده حتى لو انت عملت اختبار الفيروس انت لازم تتابع نفسك وكل يوم تشوف لو انت مثلا حاسس بايه احساسك مثلا، لان الفيروس بيبقى مختلف بظهوره. وبعد ساعات بيبقى مثلا بيجي كحة، بعد ساعات بيجي بإسهال، بيبقى درجة حرارة، بيجي بوجع في الزور، بيجي بأنواع مختلفة وأشكال مختلفة بالظهور بتاعه. لو أنت عايز مثلا تعرف او اكتر، او مثلا تعمل لنفسك سيلف اسسمنت، انت تشوف اللي هو التقييم الذاتي، بتروح على الويب سايت بتاع الهيلث يونت وبيبقى فيه عليه التقييم الذاتي وتقيم نفسك، وبعد كده تقدر تتصل بالدكتور او المستشفى او الهيلث يونت، وبعد كده يتابعوا معاك حالتك. I think this is all the questions that I have here in my screen.
Okay. Well, we went over a little bit over today, but I do thank everybody for participating. And again, thank you, Amira, for setting this up.
We thank you so much. I really appreciate your coming with us and participating with us. We really learned a lot. And I see from the client question and you answered them. Thank you so much again.
You're very welcome, Amira. And please, if you do send out an evaluation, I would be happy to receive a copy of that.
Okay, evaluation from our client?
Yes.
Okay, I will ask Sunela.
If you are sending one out, I'm just saying that it would be. I know that usually you did that in person sessions. So if you are doing that with the webinars, please feel free to pass that on to me as well.
I think Sunela with me now.
Yes, I'm here. I'm hearing you guys. I just want to let you know that after the session, we actually send out a follow-up, a thank you for participating email, and any feedback that clients would like to share with us. they can mention it in there, and then we can gather that information and send it to you. But that's kind of voluntary. So it's up to you if they want to
That's perfect.
participate in
Thank you.
that. So thank you, John, again. Thanks to you and your team for this useful information. And we actually look forward for future collaboration in delivering similar sessions. So thank you so much for your time and information again.
You're very welcome. Bye-bye now.
Thank you. Bye.
Thank you.